Hey, Suzanne here with caregiverhaven.com. So we have a couple of great questions sent in from our members today, and this is the heart of everything, I've got to tell you. So anyway, here's the first question. Mom takes a handful of pills before breakfast. Prescriptions, vitamins, gummies, and a supplement her friend swears by. She's dizzy, constipated, and forgetful lately. When I ask what each one is for, she gets mad and says, I'm making a big deal. I'm not trying to control her. I'm trying to keep her safe. How do I tell if this is too many meds? Leah from Wisconsin. Leah, I have seen this over and over again. You are not alone on this. Her very symptoms that you are seeing is most likely due to medications. You are right to look at the medications. Every provider looks at the medications first when you describe those symptoms. So the first thing you're going to do is you're going to count everything. You're going to count up the prescriptions, the over-the-counter supplements, the vitamins, the minerals, the drug that she's taking from her friend, anything. And these gummies, I don't know what those are for, but all of these natural products too, you're going to go ahead and put those on a list. You're going to put the doses and you're going to put the reason why she is taking them. And you're going to have to ask her why she thinks she's taking them. And you're going to have to ask the pharmacist why she is actually taking them, because those are two different things. Many times a patient would say she's taking it because the doctor prescribed it. That's not an answer. It's got to be a diagnosis. It's got to be, why is she taking it? It makes me feel better. No, that doesn't work either. It's got to be a reason why. Okay, a couple of things you need to know. Number one is the word polypharmacy. Polypharmacy means you're taking a lot of medications. All right, they're taking over 10 medications, which brings me to the next definition. And that definition is the rule of 10, the rule of 10. Many physicians go by this rule. This rule says that your patient cannot take more than 10 medications, including the vitamins and the minerals, including the powders, the creams, the eye drops, the ear drops, the nose drops, the inhalers, the anything that goes on or in their body. No more than 10, the rule of 10. And what the providers do that go by this rule is if they add a new medication, they have to take one off. Pharmacists love this because this is the right way in a pharmacist's mind for people to use medications. Medications are dangerous. You know, just because we think it's over the counter, we think it's safe. But one of the biggest medications that are over the counter used to be a prescription until 1985. And then it became over the counter because it was deemed safe. Now we know there's a very high risk of causing dementia. Remember, dementia is a disease. It is not a natural form of aging. It is a disease, and this disease is caused by this medication. What is the name of this medication? It is called diphenhydramine, also known as Benadryl. It is found in Tylenol PM, Advil PM. It is found in allergy medicines. And when the pharmacist starts to look at all this list that you're going to make of what your senior's taking, see how many times they find this diphenhydramine. It's amazing. It's in sleep aids because it has a great side effect for sleeping. So that's the hidden safety factor behind these. So you are not wrong to start looking at these. All right, so the first thing to do is you're going to make that medication list. And why are they taking them? The pharmacist can tell you why he or she thinks they're taking them, but the doctor is the only one that when they prescribe a medication will be actually able to tell you why he or she prescribed it. So if your mom is taking it because a friend gave it to her, then what is it for? Not, it makes me feel better. What is it actually doing? Ask one pharmacist, one you like, and one that speaks on your level and you can understand them, what to do a medication reconciliation. That's another term. Medication reconciliation means that they are going to spend a couple of days looking at all these medications and going over every interaction, They've spent 5 years doing this. They have a doctorate degree in pharmacy. They know what they're doing. Get the pharmacist to look over all these medications. Then he or she will call you and sit down with you for an hour and your mom and discuss these medications and tell them what to ask and tell you what to ask the doctor, what needs to change. Because most seniors have more than one doctor. They have a broken, fragmented healthcare system where they're seeing a specialist here and a specialist there, and nobody's paying attention to what these medications are doing to your mom. Only you are paying attention. All right. Watch for side effects after the new medication, like the dizziness, the constipation, or confusion. Constipation can occur up to 2 weeks, 3 weeks later. We just don't know. It depends on the medication. Okay, now for the second question. Dad's weekly pill box looks like a tackle box. Well, we all know what a fishing tackle box looks like. Okay. He's on meds for blood pressure, sleep, pain, and for nerves, whatever his nerves mean. All right. He seems flatter and more confused lately. I keep thinking, does he need all of this, or has nobody reviewed it in years? You bring up a good point here I want to talk about. When I suggest reviewing his meds, he says, my doctor knows. I'm not so sure. Greg in Nevada. Greg, I'm glad you brought this up because this is something that I rarely mention, and I really do. Many of my senior patients were on the same medication with the same doses over the years, but their body at 65 was not the same at 75, and nobody was doing a medication reconciliation to reevaluate the drugs. So now you start seeing the symptoms. Many people will tell me, they'll come in the office and they would say, well, he's been taking that drugs for years and he's never had that problem. And the first thing I have to think is, wait a minute. How many years ago was he given this medication? His body has changed since then, especially if this person has had any infections, if they've had any strokes, if they've had any hospitalizations, if they've added any new meds to it, taken off other meds to it, over-the-counter medications, anything can change. So we have to reevaluate the dosage of these medications because now it's not the dose, it's not the medication, it's the fact that the body has aged, okay? Maybe the liver isn't working like it used to. Maybe the kidneys aren't working like they used to. I have to do this mental gymnastics when I was in medicine to constantly go over what is going on in my brain while the patient is talking to me and when their daughter or their son is talking to me. So I had to think about the aging process here too. Very important. So thank you for that. The other thing is we have talked about stacking medications. We've talked about polypharmacy when they're on too many medications. We've talked about the rule of 10, where they're on more than 10 medications, which many physicians live by that rule, no more than 10, including the vitamins and minerals, sleep aids, and everything else. And then we also talk about something called stacking. Stacking is when they're taking a sleep aid, they're taking a medication for sleep, and then they go out and they buy over-the-counter something like Tylenol PM, Advil PM, which has a sleep effect also. And they might even be taking an allergy medicine, which causes sleep as well. So they've stacked 4 medications for sleeping, and they don't even know it, because all these side effects cause sleep. So you see, side effects are just as important as what the active ingredient is supposed to do. So the active ingredient in a Tylenol PM, you might say, is Tylenol to get rid of the pain. Yeah, but the side effect is the Benadryl, because the Benadryl is causing drowsiness. Okay? All right, the next thing we have to look at is something that you're going to make this list. You're going to give it to the pharmacist. But there's something called prescribing cascade signs. Prescribing cascade means that new medications are added to treat the side effects of old medications. I saw this many times in my practice when somebody would call in, and let's say I gave them a medication for gastrointestinal problems or constipation. I gave them medication for constipation. Then I got a message 2 or 3 days later, mom's having diarrhea. And so without checking the chart, without knowing any different, and I had to be careful on this, I could have prescribed something for the diarrhea. So now I am cascading her medications. I gave her a medication, and now I'm giving her something else without looking at the chart and saying, hold up, this is the medication that's causing this. So let's back down on it and see what's going on now. Give her a couple of days to readjust her her gastrointestinal tract. Okay. The same thing with something like Miralax. Miralax is a great medication for many seniors who are constipated, but they had to adjust the dose on that. Some days, and depend what they ate too. So they often start out with a capful every day, 1 capful a day, and it would take 2 or 3 days, and they'd start having loose, and then they'd get diarrhea. So then they'd back it down to a half a capful, and maybe that worked for them. Maybe a quarter of a capful would be just enough for them. They always had to readjust, and it really depended on their stress level, if they were traveling, or what they ate. And so they were constantly adjusting their Miralax capful, or half a capful, or 3/4 of a capful, or a quarter of a capful, but they took it consistently every day, because if they stopped it, bam, they're constipated in 2 or 3 days. So they never stopped it. They just readjusted it. It created a habit of taking it every day. That's something that the doctor and the pharmacist has to talk to you about, because it also depends on the medications you're on. So you can't just do it because that's the way I said to do it. You always have to check with the doctor, because again, this is all about educational purposes. This is not about me being your physician assistant. Can't do it. You've got to talk to the doctor first. All right. The second thing is you have to ask about the Beers criteria list, and you have to ask the pharmacist if any of the medications are on the Beers list, because that is a signal that seniors may have to use these medications with caution or not be on them at all. Then request one change at a time, so you can track what medications are causing what. You don't ever change all the medications. If we were going to figure out who was the culprit here, who was causing the side effect, especially when they have polypharmacy, then we have to do only one medication at a time, not all of them. All right. So now you've learned several good words here that you can use in your vocabulary. You've learned polypharmacy. You've learned the rule of 10. You've learned pharmacy or medication stacking, where they're taking the same, they're taking different medications, but they all have a side effect of the same thing, or they all do the same thing. And then medication cascading, all right, where we're adding a pill to counter the side effects of another pill. All right, if this helped, please subscribe to the channel. Please give it a thumbs up and share it with others, because somebody down the hill needs it. Somebody down the road needs it. All right. And be sure to check out the free tool that I have in the description. It's going to help you just organize everything. And that's what we want you to do. Everything starts with medications. So take care. We'll talk soon. I'll see you in the next video.